We have seen in our earlier recording that breast diagnosis of breast disease early is extremely important. The tenets of early diagnosis are self breast examination, and for that we have described the early signs and symptoms so that all of you know what are the signs and symptoms to look for detecting an early breast cancer. However, do we restrict just to that, or can we do something better? After self breast examination, one could also very easily get a clinical examination done of the breasts, where a trained breast surgeon or a trained person who is able to do breast examination examines you in the similar way as we showed in the earlier episode. The diagnosis is very easily made when a trained physician examines you once every year clinically. Therefore, a physician's examination is the next step in early diagnosis of breast cancer. Then we come to the imaging modalities. Internationally, mammography is a simple X-ray taken for the breast. This X-ray is of a very low dose radiation which is not harmful to your breasts at all. Mammography is recommended in women once every year after 40 years. This is an analog machine which is the common one that is present in most centers. What does this machine do? It sends X-rays through the breast, and from the breast these X-rays are captured on an X-ray film. This X-ray film then captures the X-rays, and if there is a small lump such as this shown on this diagram, it projects onto the film as a density which is abnormal. So, this is an abnormal density in an otherwise normal looking breast. This abnormal density might be breast cancer, and it is not felt to the hand. It is only picked up on mammogram. At this stage, it is a very early cancer, or it may even be the stage 0 of breast cancer. Then we come to what is happening in India. In India, as I said right in the beginning, we have breast cancer at a very early age group. What happens in young women is that the breasts are extremely dense. What do I mean by that? As a woman grows older, the breast parenchyma, that is the glandular elements in the breast, reduce and are replaced by fat. The glandular elements create a white shadow on the mammogram, as is shown in this next film. This is a highly dense mammogram. That means the glandular elements are so much that the X-ray film shows complete white on the film. When the background is white, a tumor which also just such as this projects onto this white background, it can get lost in the white of the glandular tissue. Therefore, this dense breast, that means with a high glandular content, is not so amenable to early diagnosis with conventional mammography. That means the analog mammography that is usually available. However, for such young women, the answer is a digital mammo machine, which is shown over here. The digital mammography machine increases the sensitivity of mammography by about 45 to 50%, and when we add a tomosynthesis, it further improves the sensitivity, especially in these young women who are below 50 years of age. with dense breasts. And therefore, this gives a much better image quality. Tomosynthesis is a investigation where multiple X-rays are taken of the breast and at different angles, so that a tomographic image, or it is something akin to CT scan of the breast, but with a very low dose of X-ray. This helps to collect information at various angles in the breast, reproduces an image where the dense breast is then separated out and a tumor which is present in the breast is easily detected in spite of it being in a dense breast. Here is an image which shows you that on a 2D mammography, that is a non-digital 2D mammography, you have a lesion which is not seen. However, when you add a 3D tomo image, you see a small tumor cropping up there in the lower half of the breast, and hence can diagnose an early breast cancer very effectively.